Kind of the two dressings that I mainly wanted to talk about with you guys would be so the type of dressing, it says, is usually based on the stage of the pressure ulcer. The doctor's always going to order it, so it's not like you have to sit there and think, what would I do for this patient? Like, your doctor's going to order it. For a wound, so let's just say for like, this is a general idea. So if a wound is really like oozy and pussy and stuff, you're going to want to do a gauze dressing. And I think they call them, I was trying to find the name they call it in the book. I feel like they call it a bulky dressing or like a gauze dressing. Have you guys talked about these yet?
No.
I wanted to find the name. It'll be in your PowerPoint. I know it will be. But you would just obviously want to do that to pull some of that extra moisture off if it's too oozy. If a wound is dry and you want to kind of keep it moist and protected, you can do a transparent dressing, which it has a picture of one right here. Kind of looks like the dressings you put over IV sites, you know?
Just like the tape.
Yeah,
Stuff.
transparent dressing. A transparent dressing is also nice because you can see through it. So you can still measure the wound on it and everything. One more thing, just so you guys are covered. I don't remember them going too specific into this, but what is a hydrocolloid dressing?
Dressings with complex formulations of colloids, elastone.
Yeah.
You said components. So that doesn't make sense.
So I think a hydrocolloid dressing, okay, how do I, it kind of helps in debridement. So we can physically debride a wound by like a wet to dry where we like pull the stuff out. Or a hydrocolloid dressing has like, it forms like a layer and it kind of like eats away that necrotic tissue and like debrides it kind of. So a hydrocolloid it helps in debridement, and it also provides a moist healing environment because it's kind of like a transparent dressing, and so it allows for healing. So just so you guys are aware of that kind, just in case, but I really don't remember them going too specific into it, okay? So go with what Sister Ward teaches you. But the main idea is just that why we dress, and we dress to protect the patient from seeing it. So how would I change a dressing so that the patient doesn't have to see it? That's one thing you'll want to learn how to do. When you change a dressing, take the old one off and put a new one on, you'll want to peel it like away, or like the bottom towards the patient, and then kind of stick the new one on so that they don't have to see their wound or whatever. Is kind of how they taught us to do it. But
How are you gonna do that if you like need to measure and
I don't know.
if you have a transparent one? It's just-
Yeah, they're gonna see it anyway. So I don't know, but that's in the book. So that's good. I don't know. Things change in second semester. Yeah. So anyways, that's it.
I don't really know what I'm even trying to ask, but like kind of what I saw, like what. Maybe I should think about it for a minute, and then I'll come up with a
Okay,
question.
yeah.
let me say it.
And again, pain meds first before we change a dressing because it can be kind of painful. Especially if it's a gauze dressing and it kind of dries a little bit on it, then that can be kind of painful. I don't know, this clock is like wigging out. It's 1:42. Okay. Okay, so irrigating wounds, we kind of already talked about that. That's a normal saline again. But irrigating wounds is like we're going to deliver a solution to kind of clean it out more. And this is important. So this is where you're going to actually take a syringe with a needle on it, and you're not using the needle because we're not going to like stick it in the wound, but having that needle on there makes the stream of water that comes out more pressurized, And so that can help in debridement. And so that would be a way to clean out a wound even more than just doing some normal saline, you know. You'll want to know that it's a 19 gauge needle attached to a 35 mil syringe. I don't know where they came up with those numbers, but apparently that combination provides like the right amount of pressure. I think that, do you guys know, is that what they
30
use
mil
for
syringe?
ear cleaning out?
35.
35 mil syringe. Has anyone irrigated ears out? Is that what they use for irrigating ears too?
We used like like the biggest catheter we have.
So like a 60 syringe or?
Oh, probably just like a 30, but we use like a 16 gauge
Oh.
if we have them. And we just
Maybe
use
you
the
need a little
catheter.
less pressure,
We took like
yeah.
the IVs and like
Oh,
activated
put the needle
needles
in and just
then-
use the catheter?
And we just use the catheter because you're sticking it inside their ear.
Yeah, you don't want to poke
And you don't
something.
want to poke them.
That's interesting. I wondered about that. So
That's how
anyway,
we did it where I worked. I don't know.
that's probably how they do it. That would make sense. Anyway, that's a way to debride and offer pressure. So pretty straightforward. Usually you'll just use normal saline, but they can give you another cleaning solution, but the doctor will order that, and it won't be hydrogen peroxide. So, because that kills good stuff too. We don't want to do that.